Welcome to the MRCS Bite session on Abdomen Anatomy and Pathology, OSCE Station 1. Today, we'll dive into this topic and explore the common questions tested during the MRCS Part B exam. For more information and full course, please visit mrcsbites.com. Question 1. What are the boundaries of the inguinal canal? The inguinal canal is an important anatomical structure in the groin area, and its boundaries are as follows. Anterior wall, formed by the external oblique aponeurosis. Posterior wall, made up of the transversalis fascia, reinforced by the conjoint tendon. Superior wall, created by the arching fibers of the internal oblique and transversus abdominis muscles. Inferior wall, composed of the inguinal ligament and the lacunar ligament. Question 2. Where is the superficial ring located? The superficial inguinal ring is located in the lower part of the abdominal wall, specifically within the inguinal region. It is an opening in the external oblique aponeurosis and is situated just above the inguinal ligament. The superficial ring is the exit point of the inguinal canal and is positioned approximately 1 to 2 centimeters above the pubic tubercle. It provides a passage for structures such as the spermatic cord in males and the round ligament in females. Question 3. Where is the deep ring located? The deep inguinal ring is located within the abdominal wall, deep to the superficial inguinal ring. It is situated just above the inguinal ligament and is an opening in the transversalis fascia. The deep inguinal ring is found approximately halfway between the anterior superior iliac spine and the pubic symphysis at a point known as the mid-inguinal point. It serves as the entrance to the inguinal canal, through which structures like the spermatic cord in males and the round ligament in females pass. Question 4. What structures pass through the inguinal canal in the male and female? In males, spermatic cord contains the vas deferens, ductus deferens, testicular artery, pampiniform plexus of veins, autonomic nerves, and lymphatic vessels. Ilioinguinal nerve, a branch of the lumbar plexus that provides sensation to the skin over the groin and the upper medial thigh. In females, round ligament of the uterus, a fibrous cord that helps anchor the uterus in place. Ilioinguinal nerve, also present in females, providing sensation to the skin over the groin and the upper medial thigh. Question 5. What are the contents of the spermatic cord? The spermatic cord, which runs through the inguinal canal, contains several important structures. Vas deferens, the duct that transports sperm from the testicle to the ejaculatory duct. Testicular artery, supplies blood to the testicle. Pampiniform plexus, a network of veins that drains blood from the testicle and helps regulate its temperature by cooling the arterial blood. Autonomic nerves. These nerves are involved in the regulation of blood flow and the function of the testicle. Lymphatic vessels. These vessels help drain lymph from the testicle. Cremasteric muscle. This muscle helps raise and lower the testicle for temperature regulation and protection. Question 6. What is the origin of the following vessels? Testicular artery, artery to the vas deferens, and cremasteric artery. The testicular artery originates from the abdominal aorta. Specifically, it arises from the aorta just below the renal arteries. Artery to the vas deferens typically arises from the superior vesical artery, which is a branch of the internal iliac artery. The cremasteric artery arises from the inferior epigastric artery, which is a branch of the external iliac artery. Question 7. What are the boundaries of the femoral ring? Anteriorly, the inguinal ligament, which forms the upper border of the femoral canal. Posteriorly, the pectineal ligament lying anterior to the superior pubic ramus. Medially, the lacunar ligament, also known as the Gimbernatz ligament, which extends from the pubic tubercle to the femoral vein. Laterally, the femoral vein, which is the primary structure that forms the lateral boundary of the femoral ring. Question 8. What structures are found in the femoral canal? The femoral canal is the most medial part of the femoral sheath, which also contains the femoral artery and vein. Here's a detailed overview of the structures found in the femoral canal. Lymphatic vessels. These are primarily responsible for draining lymph from the lower limb and can include lymph nodes. The lymphatic vessels help in the immune response and fluid balance. Femoral branch of the genitofemoral nerve. This nerve provides sensory innervation to the skin of the upper medial thigh. However, it's not always present within the canal and can be found in other locations. Deep inguinal lymph nodes. These nodes are part of the lymphatic system and are situated within the femoral canal. They help in filtering lymphatic fluid and play a role in immune function. Connective tissue and fat. These structures fill the space within the femoral canal and provide support and cushioning. Question 9. Name some differential diagnoses for swelling the femoral triangle. Femoral hernia, inguinal hernia, lymphadenopathy, abscess, saphenous vein varicosities, soft tissue tumors such as lipomas or sarcomas, hydrocele, psoas abscess,